male prison inmate methylene blue for pain. Remarkably, the researchers found that methylene blue changed the entire state of the nerves. Just a few hours after subcutaneous injection or oral administration of methylene blue, painful inflammation of nerves subsided extraordinarily, often entirely with further injections. Since that study, much research has been done on methylene blue's ability to relieve pain in different afflictions, such as post-operative pain caused by surgery, chronic shooting pain, oral mucositis caused by chemotherapy, arthritis, migraine headaches, and chronic low back pain. We will explore all of these now. Methylene blue for surgical pain. Surgery to remove hemorrhoids is called hemorrhoidectomy and has been associated with considerable post-operative pain and discomfort. In a 2014 trial, doctors tested the impact of injecting methylene blue under the skin surrounding the anus before slicing off hemorrhoids. Group 1 received injections with the anesthetic Marcaine and saline before surgical dissection, and Group 2 received injections of Marcaine and methylene blue. The mean pain scores were significantly lower, and the use of paracetamol, acetaminophen, was also significantly less in the methylene blue group during the first 3 post-operative days. The study reports and concluded that methylene blue was useful in reducing the initial post-operative pain of open hemorrhoidectomy. Methylene blue for chronic neuropathic pain. Chronic neuropathic pain is often described as a shooting or burning pain caused by dysfunction in the nervous system as the result of trauma, infection, or restriction in blood supply to tissues, ischemia. Sometimes it is relentless and severe, and sometimes it comes and goes. In 2015, scientists from the multidisciplinary pain clinic at Uppsala University Hospital in Sweden conducted a clinical trial testing methylene blue on patients with neuropathic pain. 10 patients were randomized to either receive methylene blue or placebo. Results show that within 60 minutes of administration, patients who received methylene blue experienced pain relief. And over the next 48 hours after administration, the decrease in pain was significant. Methylene blue for oral mucositis. Oral mucositis is a common and debilitating side effect of chemotherapy and radiotherapy treatments for cancer. It manifests in the form of painful inflammation and ulceration of the mucous membranes in the mouth. Oral mucositis is a common and debilitating side effect of chemotherapy and radiotherapy treatments for cancer that manifests in the form of painful inflammation and ulceration of the mucous membranes in the mouth. In 2021, Carlos J. Roldan and his colleagues at the University of Texas gave an oral methylene blue mouth rinse to 281 cancer patients with oral mucositis. Pain scores were reduced from 7.7 to 2.5 after methylene blue oral rinse, and most patients achieved pain control after the first 3 doses. This led the researchers to conclude MB oral rinse is an effective and safe treatment for refractory pain from oral mucositis related to cancer treatment.
To keep listening to this audiobook, I've left you a link in the description so you can do it at no cost thanks to Audible's 30-day free trial.